Hi guys, Dr. Monty here. Today we're going to be talking about a few different things, but it's going to be a little bit of a four-part series altogether. We're going to be going over about how to manage different spaces that are within your arch inside your mouth. So these spaces could get generated by a lot of different things. Sometimes people are born without teeth that need to come in there. Also, you know, if the tooth was too far gone and we couldn't do a root canal and crown to be able to save the tooth and it needed to be pulled, or maybe at the time you just didn't have the means to be able to take care of this space but needed to get it pulled to get out of pain. Quite often we find ourselves in a predicament where, just like this gentleman that we had, we're missing teeth in certain spaces. Now, the biggest thing about this is we need to make sure that we preserve spaces within our arch, because if we don't, your teeth, they like to touch each other on the tops and the bottoms and the sides, and if you don't, they start tipping to try to find their buddy, basically. So when you do that and these teeth start tipping, which you can already kind of tell this one is, then you start getting periodontal issues. That's areas downside, underneath your gums, inside your bone, where you get plaque and calculus build up down in there, and you can actually start losing the bone in between your teeth and make them loose, and even have to lose them due to that. So what we're going to talk about are different ways that you can manage your space. You can do something like a removable prosthesis. Now that's what these would be called. Now your dentist may initially, if you had to get a tooth taken out, use something like this. This is just an interim partial, meaning it's something that's getting you by. Now what this will do for you, it'll keep the space perfect in between your teeth, and it'll allow it to clasp in place and get you used to taking something in and out of your mouth. Get used to talking with it, get used to eating with it, and everything else too. So this is a great starter to go into that. Now after this, you need to move on to something that's going to be more of a permanent solution. And for that, you would do something more like this, a removable partial. Okay. Now this is a cast metal removable partial, and there's other types too. There's also a flexible one that doesn't have the metal substructure underneath it. But you can use this and it will replace multiple teeth around your arch. In the front even, it's very nice and aesthetic whenever you get it placed, as well as, you know, all kinds of back teeth and stuff too. Then we moved over into what are called the fixed things. Now this one would be what's considered to be a fixed bridge. And we get this one single piece back from the lab that we can take and then cement into place. And what it'll do, it'll have two regular teeth on both sides and then a fake tooth in the middle. But it cements in, so it's not something that you take in and out of your mouth all the time. It'll always be in there for you. Okay. Now the third option is getting into something like dental implants. Dental implants are great because it's kind of like replacing a tooth with a tooth for the most part. What we'll end up doing is in the space that's created, put a dental implant down here into your bone, put a healing cap on top of it, then after it heals for a little while, we go through and then put a permanent crown on top of it. It's great because you can floss around it on both sides and you don't have to worry about not being able to keep it clean. So it's a great option for replacing different teeth around your entire arch. So those are just some of the things that we can do to help maintain the spaces and to fill them in later on whenever we get going. So what we're going to talk about in the next few videos are a little bit more specifics into the prosthesis that we were talking about. Thanks.